The Model Systems Knowledge Translation Center presents Gait Training After Spinal Cord Injury. This slideshow is based on research conducted by the Spinal Cord Injury Model Systems and serves as a resource for individuals with spinal cord injury and their supporters. The Model Systems Knowledge Translation Center is funded by the National Institute on Disability and Rehabilitation Research. This resource summarizes the research on gait training after a spinal cord injury that can help people living with spinal cord injury understand gait training, work with their physical therapist or clinicians to identify treatments that help improve mobility. Gait training is practicing walking, also called ambulation, with assistive devices and braces as needed. Gait training is needed if a spinal cord injury damages nerve cells and their connections. This damage can prevent movement signals from the brain to the muscles, causing weakness or paralysis. The injury can also damage and disrupt nerve signals for sensation, so that parts of the body are without sensation or have abnormal sensations, such as burning or tingling. These problems can lead to difficulty walking, increasing the risk of falling, or result in the inability to regain walking. There are gait training categories that are used by health professionals to describe the kind of walking people with SCI can do. Community. You are able to walk at home and in the community. Household. You can walk within the house, but use a wheelchair as the primary way to get around in the community. Exercise. You use a wheelchair in the community and at home, and walk with assistance once or twice a day for exercise. Non-ambulatory. You only use a wheelchair for mobility. You may also walk while doing gait training with the therapist in a therapy gym only. Is gait training right for you? A physical therapist or other clinician will determine if gait training is right for you using a variety of tests. The test will measure strength, sensation, spasticity, stiffness, ability to stand up, balance while standing, and range of motion at your hips, knees, ankles, and trunk. The clinician may also provide assistive devices and braces to give you better balance, protect your joints, and ensure your safety as you walk. He or she may then test your walking speed, endurance, and balance with these devices to keep track of your therapy progress. If you experience falls while walking with or without assistive devices, be sure to tell your health professional, as you may need different walking supports and/or more training. People with SCI can have fragile bones due to lack of physical movement, so falling can cause broken bones. Preventing falls is a top priority during gait training and walking in the community. What are the gait training treatment options? During early gait training, you may take your first steps after the SCI using a variety of equipment, including parallel bars, a pool, or a body weight support device. A body weight support device lifts part of your weight through a harness you wear as you try to take some steps. Some of these devices roll on the ground, and some are placed over a treadmill. Your therapist, a therapy team, or a robotic device may help with your balance and stepping movements. During later gait training, depending on your SCI, your therapist may work with you on the ground without a body weight support device or parallel bars. You may also be given assistive devices and/or braces to improve your balance and help you walk safely. A device may be more or less appropriate depending on your strength and balance. It is helpful to experiment with different assistive devices and braces to find what is right for you. Some of the optional assistive devices are special walkers that have safety straps at your hips and trunk, a standard walker with no wheels on the legs, a rolling walker, walker with 2 wheels on front legs if your balance is a little better, a rollator walker, a walker with 4 wheels and a basket if you have good enough strength to walk in the community but still need help with balance, a forearm or loft strand crutches if you have sufficient strength to walk in the community but still need help with balance. Braces can have many benefits, such as protecting weak joints and preventing knee hyperextension by keeping your joints in the proper alignment as you put weight on them during walking, reducing the risk of falling by helping keep your knees straight and your toes up as you walk, increasing your walking speed and amount of time you are able to walk. The different types of braces are ankle-foot orthosis or AFO, knee-ankle-foot orthosis KAFO, hip, knee, ankle-foot orthosis HKAFO, floor reaction orthosis for people with knees that buckle, or supramalleolar orthosis SMO at just the ankle to keep you from turning your ankle. The ability to walk after a spinal cord injury depends on these factors: level of injury, severity of injury, time since injury, age, level of fitness, other injuries, level of sensation, other related problems such as spasticity and joint problems or contractures, and level of pain. Will gait training work for you? The ultimate goal of gait training is to be able to walk in any community environment with minimal or no assistive devices or braces. Every individual progresses in therapy at their own pace. Some people may learn to walk well in a few months, and others may take years, while others are unable to progress beyond walking in therapy. For additional resources on spinal cord injury, please visit the Model Systems Knowledge Translation Center website at www.msktc.org.